Talking with patients about their Parkinson's disease is often a discussion about moments. All the moments that make up a day. The moments that matter. For many patients, off episodes may occur during those moments, and off time can be unpredictable. In fact, about half of patients with Parkinson's who began taking levodopa-carbidopa experienced off time within 5 years. Many Parkinson's treatments focus on increasing dopamine, but there's more to consider than just dopamine. There's also adenosine. Both dopamine and adenosine regulate movement. If you think of the gas and brake pedals in a car, dopamine acts like the gas to initiate movement. Adenosine is like the brake, suppressing movement. In Parkinson's disease, there is too little dopamine activity and too much adenosine activity. The imbalance can cause problems with movement, and your patients may experience off time. You can help your patients reduce off time by adding NOURIANZ, istradefylline. NOURIANZ is an adenosine receptor antagonist indicated as adjunctive treatment to levodopa-carbidopa in adult patients with Parkinson's disease experiencing off episodes. It's different from other add-on medications for Parkinson's disease. NOURIANZ is the first medication of its kind that lifts the brake of adenosine to treat off episodes. Although the exact way it works is unknown, in animal studies, NOURIANZ reduced off time by blocking A2A receptors. The most common adverse reactions in clinical trials were dyskinesia, dizziness, constipation, nausea, hallucination, and insomnia. So when thinking about conversations you have with your patients, consider adding NOURIANZ to help your patients break for what matters to them. Please keep watching for full important safety information and visit nourianzhcp.com to learn more. Important safety information. Warnings and precautions. Dyskinesia. NOURIANZ in combination with levodopa may cause dyskinesia or exacerbate pre-existing dyskinesia. In clinical trials, 1% of patients treated with either NOURIANZ 20 mg or 40 mg discontinued treatment because of dyskinesia, compared to 0% for placebo. Hallucinations, psychotic behavior. Because of the potential risk of exacerbating psychosis, patients with a major psychotic disorder should not be treated with NOURIANZ. Consider dosage reduction or discontinuation if a patient develops hallucinations or psychotic behaviors while taking NOURIANZ. Impulse control, compulsive behaviors. Patients treated with NOURIANZ and one or more medications for the treatment of Parkinson's disease, including levodopa, may experience intense urges to gamble, increased sexual urges, intense urges to spend money, binge or compulsive eating, and/or other intense urges, and the inability to control these urges. In clinical trials, one patient treated with NOURIANZ 40 mg was reported to have impulse control disorder, compared to no patient on NOURIANZ 20 mg or placebo. Drug interactions. The maximum recommended dosage in patients taking strong CYP3A4 inhibitors is 20 mg once daily. Avoid use of NOURIANZ with strong CYP3A4 inducers. Specific populations. Pregnancy, based on animal data, may cause fetal harm. Hepatic impairment. The maximum recommended dosage of NOURIANZ in patients with moderate hepatic impairment is 20 mg once daily. Avoid use in patients with severe hepatic impairment. Adverse reactions. The most common adverse reactions with an incidence greater than or equal to 5% and occurring more frequently than with placebo were dyskinesia, 15%, 17%, and 8%, dizziness, 3%, 6%, and 4%, constipation, 5%, 6%, and 3%, nausea, 4%, 6%, and 5%, hallucination, 2%, 6%, and 3%, and insomnia, 1%, 6%, and 4%, for NOURIANZ 20 mg, 40 mg, and placebo, respectively. You are encouraged to report suspected adverse reactions to Kiowa Kirin Incorporated at 1-844-768-3544 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full prescribing information at the link provided below.